Hey everyone, so today we're going to go through 3 different exercises that you can use to help with the lateral elbow pain. And more importantly, we're going to go through the sequence that we would typically use to integrate these exercises into a rehab plan with a client with specific limitations around the elbow joint. We're also going to go through the thought process behind them as well. So the first thing we need to do is identify a movement limitation that we can use to guide our loading progressions, that we can use to guide our loading strategies. And the common limitation that we find in lateral elbow pain is a lack of capacity to express pronation at the forearm segment. Okay, both the range of motion expressed into pronation and the capacity to produce force into pronation. Okay, so that's something that we want to try and improve very commonly. Now, pronation at the forearm segment is an internal rotation of the forearm towards the midline. Okay, so when we're trying to improve both range of motion and the capacity to produce force into pronation, what we want to try and do is take advantage of the neighboring segments, the proximal segment in this case, the humerus. So what we can do to facilitate that pronation at the forearm is use the humerus and internally rotate the humerus to facilitate that internal rotation of the forearm segment. And that can help us improve that range of motion, that can help us improve that capacity to produce force into pronation of the forearm early on during the rehab process. Okay, so we're using this facilitation strategy early on during the rehab process, and then as we progress throughout the rehab process, then we can start to challenge this relationship between the humerus and the forearm segment. So in the first strategy, you can see that facilitation reflected. We're in a seated position, and with the humerus internally rotated, we have the forearm in a position of supination, but we're producing force into pronation from that supinated position. Okay, and then as we progress, we can change the positioning of the forearm into more and more pronation. Okay, and with this, we're going to perform 3 sets of 30 to 45 seconds at 30 to 40% of your maximal capacity. This second strategy here, it's just one option that we can use to progress things, where we're now challenging the elbow in the sagittal plane. Okay, and we're getting load into the tricep. So we're extending the forearm segment, getting load into the tricep, instead of generating that force into the rotation at the forearm segment. But we still want to maintain that pronation at the forearm. So we'll hold on to that humeral internal rotation, that forearm pronation internal rotation. We've got a ball around the hand or in the hand with a band around the ball, and this gives the hand a little bit more variability, which is a really important feature, especially in clients that are lacking rotation of the forearm segment. So it's an important thing to integrate early on. Okay, and with this one as well, we can perform 3 sets of 6 to 8 repetitions. And lastly, we want to try and challenge that rotation relationship between the forearm and the humerus as we continue to extend the forearm and lower the tricep and the elbow in the sagittal plane. So we're going to externally rotate the humerus and try and hold on to that pronation, that internal rotation of the forearm. Okay, and the reason that challenges pronation, the maintenance of that pronation, is because as we externally rotate the humerus, that's going to want to try and drag the forearm in the same direction into external rotation. Okay, and that can be particularly tough if the client has been limited in pronation for some time. So we can perform 3 sets of 6 to 8 repetitions here. So this is just one of many loading progressions that you can use with your clients expressing issues around the elbow joint, particularly the lateral elbow in this case. But we need to remember that this is based around a specific movement limitation, because that gives us clarity with our loading progressions. Okay, we're not just loading the elbow for the sake of loading the elbow. We're loading the elbow with an understanding of how we're organizing the segments, how we're organizing the load through the muscular tissues as well. Because we always need to assess the unique needs of our clients. And again, every client is going to have different needs, every client's going to have different limitations, and every client's going to progress at different speeds. But hopefully this loading progression gives you some ideas, gives you some options to use with your clients.